Hi everyone, I am so excited to bring you this chat I had with Susan Clinton and Shelly Prosko a few days ago. We were brought together by the Women on Fire conference in Brighton in the UK, and Shelly flew in from Canada and Susan flew in from America, and it was fantastic to have the opportunity, and I'm very thankful to Michelle Lyons and Jenny Burrell for bringing them over to speak at the conference because it meant that we got the opportunity to hang out, and we've been friends and kind of peers, and I've been looking up to these guys a lot for the last couple of years, so it was so good to be able to spend some time in their company and learn from them. And we really should have filmed everything we spent together, the complete weekend together, because we just had so many epic chats. Because when you put these two in a space together, and even when we've got no energy, you get so many wonderful pearls of wisdom. So I'm so glad that we managed to sit down. We sat down originally for 20 minutes and ended up, I think, talking for about an hour and a bit, all about pelvic health physio, compassion, treatment, how you lead patients, how you coach them. Lots of really cool pearls of wisdom that I'm excited to bring you. So Susan, if you aren't familiar with her, Dr. Clinton is a physiotherapist, a physical therapist from Pennsylvania in the US. She a co-owner and founder of Embody Physiotherapy and Wellness. She's an active teacher, researcher. She's an adjunct instructor for the University of Pittsburgh, Chatham University, Slippery Rock University. She's also an international lecturer, which is probably where most of us know her from. She does a lot of teaching all over the world and has done for a long time. She's an incredible wealth of experience and knowledge. And she's written countless publications on chronic pelvic pain, clinical practice guidance. She's involved in the American Physical Therapy Association and the chapter on women's, or section on women's health, which is going through a name change at the moment, and does lots of other stuff, including she's a member of this non-profit Women's Health Global Initiative, which sounds amazing, which is developing obviously women's health throughout the world, kind of promoting how we can bring minds together and develop them and develop services for women all over the world. She's just really cool. And then there's the wonderful Shelly Prosko, who I met in Washington not last year, oh goodness me, 2017 in Washington for World Congress on Abdominal and Pelvic Pain. Shelly is a Canadian physiotherapist or physical therapist. She's also a yoga teacher, an instructor, a speaker. She's written a really cool new book, which I think is going to be really important for those of us that cross over and we do some exercise class teaching, which covers yoga and pelvic pain, I think it's called. I'll put a link to it underneath here, but it's coming out soon. She's written a really beautiful chapter on compassion in therapy and compassion for the therapist, exploring all of the different paradigms and all the different all the kind of teachings that we have about that and ways to approach it, which is partly what she presented at this conference last weekend. She is a respected pioneer in physio yoga, in how we use yoga within physiotherapy to help with pelvic health conditions. She lectures to universities and medical colleges. She's at numerous conferences. She's been all over the world teaching. She's again an international teacher, which is where many of us will know her from. She's in the moment working on some research with her local university, which I have no idea where it is, but the world is a big place. She can make university, no, I can't remember what it is. Anyway, it's cool. So without further ado, I will let you have a watch of this video. I'm so excited. We sat down at the end of a long day, so we were all really kind of hot, and then the room got really quiet and cold. But we sat down at the end of a long day and had a really nice chat about what is important to us and the themes that we'd been discussing for a couple of days about how we approach compassionate pelvic health physio. So I hope you enjoy this, and whatever you're doing while you're watching this, cleaning, some people tell me they clean, doing some hoovering, doing some housework, whatever it is, I hope you enjoy this chat, and come back to me, have a look, message me on Facebook, send me some comments, let me know how you're getting on with your practice. Remember, you can always use the link down below to join up to the newsfeed, and you'll get the newsletter through once a month, and there's some freebies coming out and some new clinical guidance stuff that we're talking through. So it's a good place to start if you're interested in pelvic pain and treatment. Okay, I'll get off now and let you listen. All the best. Speak to you soon. Bye.
One of my pet peeves is when people talk about straightforward injury, like, you know, even if it's musculoskeletal, like an ankle sprain or like something, or even straightforward, you know, some back pain, one episode, it's acute, they've never really had problems with it before. Just straightforward. You don't need to get into all that psychosocial junk, or, you know, people will say, just don't worry about all that. We're not counselors. We talked about that last night. That drives me crazy because you can't not be biopsychosocial. Sure, the drivers might be more biomechanical, the driver might be more, you know, coming from tissue, but
that's why it's biopsychosocial.
Exactly.
So you don't not consider the tissue or the movement pattern or the thing that's the problem, but you consider it amongst it's the psychosocial pieces. So you don't ignore it, but you don't just exclusively do it.
Right, yeah.
Right,
and
because how do you know what's important to the person if you don't ask those questions?
Yeah.
Because their back pain may not be important to them.
So many people are coping fine with
Yeah,
back pain.
their ability to not go to the gym or their perceived fear of not being able to go to the gym may be what's important to them. And it's like, then let's get you to the gym. We're just going to figure out how to modify it rather than we're going to do this to your back and do that to your back and crack your back, and then you're going to do these 3 exercises and you're going to come back 4 times a week. And
because you have black discs on your x-ray.
Right, exactly. And so then they're kind of like, okay, well, I'm going to do this, but it's not really what I'm worried about.
Yeah.
Instead say, look, this is a thing that happened. Your back is really resilient. For whatever reason, it just got sensitized. What's going on in your life? What happened? Like, did this ever happen before? Have you had this before? Is this familiar to you? Is it, what is it? And, being able to find out those kinds of questions,
So we were talking about earlier when I say, where are the bears?
Yeah, where are the bears? Yeah.
What bears have you got in your life? What stresses? And I have patients now that, I have a couple of consultants that are funny now, and they say, oh, my patient told me about her bears. But when the patient comes in, and I've had a few come to me and say, I need your help. I'm so commonly patients with bladder pain syndrome. It's just gone mad for no reason. I don't know why. And you've got to help me find the bears. And I'll go, well, let's talk about but there's nothing changed. Nothing's happened. And the last one I spoke to, actually, she just hated her job. And I said, okay, so you need to look at a different job. And that's okay. You're allowed to leave your job if you hate it. And she went, went away, came back the next week, had applied for a job, felt loads better. And the system will sensitize. She will have real bladder pain, real inflammation, real dysfunction, but based on other stresses within the system.
Yeah, and those are other psychosocial drivers.
Yeah.
But even in cases where it may not appear to be like a lot of psychosocial drivers, like I said, like it could be an acute ankle sprain, or like even in those cases, I guess what I was getting at too is like you're still looking at the whole person, and so maybe they don't really have any stressors per se, but how they come into the clinic. So it's, let's say, the 3rd session, and someone just cut them off in traffic or something happened, and they're just a little angry, their muscle tension's a little bit higher, they're a little bit irritable. Like that's going to kind of affect maybe how you start the session and go from there, or how they slept maybe the last 2 nights, and what you were saying, like what they value most, really looking at those patient valued goals and what matters most to them and what they want to get back to. And so that is all biopsychosocial, I guess. I just wanted to.
Well, I think it kind of goes
it always is.
Along the story of when you were in the pool, and you couldn't, you were only able to go so far, and then you couldn't breathe, and your coach said to you,
what's going on?
What's going on? And you were just more anxious that day, and with the anxiety, you're not going to be able to breathe as well.
Yeah.
So rather than forcing you to keep doing the same activity, he helped you identify what was happening so that you could actually modify what you needed to do around that activity so you could be better at it. So like back with the ankle, if they're irritable and they haven't slept, are they going to be able to is that the day to challenge them on balance activities, or is that the day, are they going to even hear you? Is this even, what is it that we need to do? How do we need to change it based on how the person is presenting today?
And it's totally okay to do that. And within the UK, because we have such a strict regimented NHS system where we have this minimum data set where we feel that we have to tick all the boxes, everyone is always very much like, well, today I have to do something with you to progress my minimum data set, my next goal. When actually one of the most powerful things you can do is put your pen down and listen. And there's I saw a patient last week who I haven't seen for a month, who had chronic back pain, but she'd coped with it for years and then had an acute flare-up, and at the same time had some knee pain when we were managing her back pain, and we'd done a very much kind of like, let's get you moving, let's get back to the gym, you're resilient, let's keep going. And every time I saw her, actually, it just became a session where she offloaded all of her work and family stress because they were linked. And at her last session, she came in, and we weren't even, by this point, we're not even really doing any true physio, in that I was giving her generalised concepts of things to do at the gym. Have you managed to get, what thing can we do once this week? Can you go for one swim? Can you go to the gym once because you like it? And eventually she just came in and said, actually, it's just really helped because I decided I need to make these changes in my life. And I really valued all of your help in this time and listening to me. You're the only person that listened to me, and no one else would. And so when she came back and said, actually, I hate the gym, I don't want to go to the gym. And I was like, well, that's fine. Why were you telling me that you wanted to go to the gym? Who wanted you to go to the gym? Great. If you just like walking, then go walking. And her pain is now fine, and she's coping well. And it was just about life stresses. But we aren't counsellors, like you were saying yesterday, but we certainly have to be humans.
No, but we're coaches.
Yeah.
We may not be counselors, trained counselors, but we're coaches.
Yeah,
and we should be able to help people advocate for themselves and make decisions for themselves based on the knowledge that we can give them and the fear we can help them avoid. So instead of us saying this is the only way out of your situation, help them figure out their best way out of the situation.
Well said. Yeah.
And I think that's really important, because now they're going to have the tools to take care of themselves.
Yeah.
Right? And they're not going to be dependent upon me, my back is hurting, I have to go back. My back is hurting, I have to go back. Oh, no, actually I can sort this out. I can figure this out. I can go back if I can't sort it out, but they have tools now, And I love the thing you were saying about, I didn't want to go to the gym, I don't like the gym. Well, why'd you say you wanted to go to the gym? Well, I think I should go to the gym. Life is too short to do things we should do.
And
we need to do things we want to do, So when Michelle was saying today, exercise is non-negotiable at a certain point in your life. Movement is actually what she said, not exercise.
Yeah.
But you still have to find what it is that they want to do.
Yeah.
So we can tell people movement's going to be essential for helping you with these other parameters that are going on with you. Like, you're not sleeping at night because you have to get up and pee. And you found out you have high blood pressure at night. So, how are you going to, what are the things that are at your disposal to get your blood pressure down? Because this is going to, you're seeing me for pelvic health, but this is affecting it.
Yeah.
All the pelvic floor muscle exercises in the world isn't going to change what's happening at night. But movement can.
Yeah.
What do you like to do? And then you can kind of guide the conversation and let them start interjecting. Well, I know I should do this, and I know I should do that. It's like, hey, that's what you should do. That's what you wanted to do.
Yeah, the should, and
don't could.
Stuck in that.
Don't you find that a lot of people, and I mean all of us, I don't know if it's our culture, I don't know if it's a human thing, I think it's probably more cultural, just the way our civilization is. We don't even know what we want because of, media and industries and commercials, like all that, that kind of industry, like telling us what we lack and what we need, like from anywhere from fitness to beauty to food, like all industries. So we almost lose our ability to know what we want. And that's one of the things I like about, just a yoga approach. It doesn't have to be yoga, but that one thing we do is like just getting still, and it's that awareness and that mindfulness, and we can help our patients with that too, like just what do you, and that reflective questioning, and that helping people self-inquire, and what matters most, what do you value most, what do you want to do. I mean, that's basic physio stuff too, patient valued goals. And then they can look at, well, I really just want to play with my great grandkids, my great grandkid's going to be born soon, and I really just want to get down. That's all.
Yeah,
so that's
like that.
Then movement, and you make it valuable and salient, and I mean, this is stuff that we know,
simple stuff,
but
we've
simple.
almost overtaken the techniques and the stuff and the gubbins, as we'd say, of being.
How many visits do I need to use a wand to get the pelvic pain down?
Yeah, exactly. How much are we expecting? All that kind of stuff.
Maybe you don't need to use the wand at all.
No.
But it's kind of like how many. I want to know the recipe.
Yeah.
It's like
what is the protocol? What am I meant to do? And actually having the security to just sit back yourself in that vulnerable space with that patient and go, what is important to you at this moment, and what is going to drive your joy. And I find that a lot of the expectation goes two ways. A lot of physios also think, right, and especially the junior physios that I work with, not work right now, but in general sense, I don't want to make them feel paranoid, that will say, oh, this patient has really weak glutes, I need to train their glutes, I need to do bridges with, therabands and blah, blah, blah. And actually for that patient, unless they've got a massive Trendelenburg, it may not be that that's a significant impactor on their, strength training is important, but what makes their soul sing, what makes them joyful, is it something specifically tendinopathy linked to that chain, or, all the kind of the shoulds. And what I liked about your session this morning is that you, in every position we were in, you gave us permission to be ourselves. So it was try this, see how it feels. It wasn't this is what you should achieve. And I think a lot of the things that we do in physio have always been do this exercise so that this happens. Do this exercise so you should feel this. Your pelvic floor will relax. Well, actually, I've got a massively hypertonic pelvic floor, and it doesn't hurt at all, and it's fine. I do lots of people that do a lot of exercise do, and it's not a problem for me at all. If it becomes sensitized, well, then we're going to desensitize it. But that kind of option of let's get you into a position where it is okay to be you, and maybe you've got more internal or external rotation. Feel how it is with the breathing. Swap it up with the breathing.
And if you don't feel what I feel in that position, or what a lot of people I work with may give me certain feedback, and it's all similar, but there might be that 1 out of 10, people or person that doesn't feel that at all, and then they feel bad, or like they're not doing it properly, and then what does that do for behavior change or for compliance?
I can't do this. This is too hard.
Yeah, I don't feel anything. And what she said, you're supposed to breathe in.
I'm wasting my time, and I'm wasting her time.
Yeah, you're supposed to breathe in and feel your pelvic. I don't. What's wrong with me? It's just so I love the approach of what's going on, and then it also helps the person just really go even more into their own body, because I'm not. There's no expectations, so it's like, okay, well,
what can my
what's
body
coming
achieve?
up? What physical sensations, thoughts, emotions? What comes up for you? I don't know. I just love that one. They'll do a position I just like it. We don't know why. They just, I like that one. Okay, great.
Let's do more of that. Let's put on your music that you enjoy.
Yeah.
And it doesn't matter what music I enjoy. It has to matter what music they enjoy.
Yeah.
Have you ever had to put something on that you really don't like?
Yeah, but it doesn't bother me.
No.
Because it's for them.
Yeah.
It's their space. I'm holding the space for them.
Yeah.
I've never had anybody really come in and really want to do just raunchy
heavy metal.
the really hardcore kind of stuff.
Yeah.
But I have had some guys that have their own alternative music and their own kind of brand of stuff, and it's not music I'm familiar with. So it's always, to me, it's always kind of interesting. It's like, whoa, what's that about?
Yeah, this is you. This is what makes you tick. Yeah. That's and we were kind of talking about that yesterday, about how everything, and actually your lecture as well, came down to threat and de-threatening the system. I mean, half of it did. Half of it came down to overtraining the system, which was really interesting, and everyone should go away and read about it. But it's that kind of. I live in that world, so everything I do with patients, because I'm 80% of my caseload is pelvic pain.
Yeah.
That just, how can we de-threaten this person from the get-go? So I try to let them. I always greet every patient with physical contact of some type, unless they're not comfy with that. And I'm British, so it's can I get you a cup of tea? Would you like? I'll put the kettle on. Choose a tea you'd like. There's some milk. There's some herbals. Whatever. Have a seat on the sofa. I've got this form for you. And then I go back and see my other person. But we were talking about putting on nice scents and smell. So you're hitting from lots of sensory aspects, that this space is safe, and you are welcome in this space, and you're not expected to be anything. Right,
and I had the privilege, because we did our own build out for our clinic, so we could pick the colors. Our patient waiting area looks like a living room. I mean, it just we did that on purpose.
Yeah.
But even when I worked in corporate healthcare, because people would say, oh, well, we don't have that choice, so it's not that way. I still always kept different books out in the waiting room. So it was always interesting to me what people would pick up.
Yeah.
And I just kind of, as they came into the clinic, I mean, I put some live plants in my room. Nobody told me I couldn't, as long as I didn't have anything hanging from the ceiling with the water sprinklers, I was fine.
Nice.
So you could do different things. You could bring different pillowcases in, and you can. touches and things you can do to make the area just feel a little bit less clinical, less alcohol smelling.
Yeah.
You know, you don't have to put, you know, a diffuser in your room if you can't do it in a place like that. But you still can, you know, you can make it not be so clinical. You know, you don't have to have messy papers everywhere. You know, just pick up and have it kind of look nice and at least ordered for the person that's there. And
yeah, to immediately try and just reduce that sensitivity of their nervous system, because if they're already wound up, and this is the thing, that regardless of what injury or they're coming in with, and we were talking about my patient that many different patients of a similar type, that whatever injury they come in with, it's a massive injury to them. They may have had years of post-traumatic stress from that injury. So this person had a postnatal tear and some other complications, and that becomes a huge thing. And to us, we're kind of like, okay, I know what I'm doing, you know.
Yeah.
Blah 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 blah.
But they don't.
But they don't at all. And I think it's so important to always reflect on your own health experience and what you would want from someone. So I'm lucky I have my consultant secretary's mobile numbers, not through I never use them, but because they've given me those numbers, and that just feels like a massive gift. I think I've used them once and said, I'm having a heart attack, I'm coming in, kind of thing. But that, it just feels so much more comfortable and safe, and it's not something they have to do. And if you can create that kind of security in a patient, then you're going to get so much further with their nervous system than you would by just saying, right, I want you to bend it, straighten it, and do 3 sets of 10. Because that's what gets you better. And
this person's going to watch you do it.
Yeah.
Not like go do something else.
Yeah.
Because you're not important, you know? So, you know, but if you do have to work with a team, making sure the whole team is on board.
Yeah.
So that they know who those people are, and they know that they're...
And have a relationship with them.
Right, so that they realize that it's part of you.
Yeah.
And not, you know, because there are places where people have to work in teams, and that's fine, but you can still make it work and still make the patient be the center of it.
Yeah.
Right? So it's patient-centered, not clinic-centered in those ways.
Yeah, and so much of it is just being fully present.
Yeah.
Like, and being, well, like I think you said earlier, like just being human. Like being a good human, or one of us. There's so many conversations we had as we last night.
Right,
a couple of dinners with you, but you know, somewhere along the lines, the last couple of days, we've said like just be a good human and be fully present. Because that's the other thing, I think. Sometimes you can be a good person and a good human, but your mind is elsewhere. You know, like just be fully present, and that's one of the...
You're worried about all the other things you need to do, not the person in front of you.
Yeah, and that's legitimate, and I'm going to be talking about this tomorrow in my talk. That's one of the model. That's one of the models I'm using. There's 6 domains, and the first one is it's the attentive domain, and it's being... I mean, it's common sense, simple stuff, but it will change your practice. Like
it's
if you're having trouble,
it's mindful
just
listening.
presence. And if you have,
just
you know,
be there
4
and
people,
space hold for them. You know.
And the thing is, you can only do one thing at a time. So if you have, let's say you have 3 people, you have 3 people in the curtains. You're a busy clinician, and you're going. You can still be present. You can still be fully present. If you've ever waited tables, if you're ever a waiter, waitress, you might be going around, but you can still be fully present when you drop off the drinks and go to your next one. And that's a skill you can develop, being fully present. I mean, I'm not professing to be, good at it, but I'm definitely better than I was, and I definitely try now. And the other thing is I can see when I am wondering, and it's usually not because I'm bored or it's because I've got something on my mind that has to be attended to in 10 minutes, but I'm like, nope, and I can see when the mind goes, and then I just witness and just come back, anchor through my breath, and like I said, I'm by no means good at this, but you have to have a certain amount of emotional resilience to be there, and security in your own kind of wavering. You have to be comfortable with being uncomfortable, and we're talking about being comfortable with uncertainty, and that when patients come back and say, I'm worse, and you go, okay, so we've learned something.
Right.
Rather than, I've done something wrong.
So your pain may be worse, but what are we celebrating today?
I love that phrase. I wrote that
small
down.
victories.
Yes.
Right,
what are we
because
celebrating
something has
today?
changed, And even it may turn out that what they're celebrating is they learned what their limits were. You know, and they don't look at that as a celebration or a victory, but that's not knowledge that they had before.
Yeah.
So like you said, okay, let's sit down and work through this and find out what's happening.
Yeah. Well, the patient that came in recently with me and said, I don't know why I'm like this. I don't know what's going on, and she's got an illness.
Mm-hmm.
You know, she's got, I think it was a respiratory tract infection. I was like, you've just got over a really bad cough and colds. Your system was on edge. And your system is going to present with threat, and it knows threat, it knows bears in your vagina. So the bears in your vagina are more present. But yeah, what can we learn? I love the what can we celebrate today, because I think a lot of people, when you're talking about negative language, and I've got, I'll put the picture of your lovely, I love your brain and your gut brain. She draws a little person with little arms and little feet and gut brain and a little fuzzy pelvic floor. But it makes total sense. And then stating all the negative things that people come in with. And whenever I say to patients, so what would be your primary goal? What are we looking to achieve in a perfect world? And the first thing they say is, I don't want to be in pain.
Yeah, always.
A negative is not a goal. Is the first thing I'll say. What else is it that you want to be able to go swimming? You want to be able to walk? Do you want to be able to sit in the car for an hour to drive to your mum's? What is it? But it can't be a negative is not a goal.
Can they say that I want to be able to drive in the car and go to my mom's without pain? Are they allowed to say that?
I like to not focus on pain at all. I think as an end goal that would be in the back of my mind, but the way I work, I don't know about you guys, do you focus on pain at all? Because I try to be everything away from the pain.
So what I do is, that's a great question. I want to do this without pain. I want to do this without, pain, without pain. And what I do is that being present in the moment that's usually when I kind of lean in a little bit and go, I totally get it.
Yeah. I really understand.
Being out of pain is definitely what you want.
I validate it. I've gone a different way before, and it doesn't go well for me.
So I just let them know that because they desperately want to know.
Yeah.
They don't want you. They've been, unfortunately, many times they're not believed, they're just band-aids have been put on it, and they really have this opportunity to tell you the story, which is the suffering and the pullback and the isolation and all the other things, and the restricting of things and denying themselves of things because of this evil pain that's sitting there. And so I think when that happens and they keep coming back, that's the time to just say, I really, really, I hear you. This is a big deal, and I hear you. The pain part is big. Let's talk a little bit about how we maybe can get that pain to change somewhat. Yeah. Because pain's, and then that could actually be an entree if they're able to launch into a little bit of pain science education. Pain's an inevitable thing in life. We're all going to have pain, and life without pain would be horrible because it's protective. That's my launch into the protective system, not the offensive system. Yeah. And I just, and you can kind of gently talk to them a little bit about that and say, so instead of like driving to my grandma's without pain, I would say, how long can you sit right now before your symptoms go up? Because I hear you. I know you always have them.
And I believe that you're in pain.
Because they always say, but I'm always in pain. I know, but there's a time when it kind of changes, right? Yeah. Like, doesn't it sometimes get worse and sometimes get a little bit better? I know it's always there, just like giving them that anchor. Yeah. And then trying to get them to kind of put their own metrics on it. Yeah. Well, I don't know. I can sit maybe 15 minutes before my symptoms start increasing.
Great.
We have our first thing to start working on.
And I do that too. Yeah. And of course everyone's different. You do it in different ways, and you read them.
And use different words and
and what they're if they want to hear. But another thing is I try to really give them the experience. So do that, kind of get maybe a little bit of education there, a little bit of pain biology education if it fits there. And then let's say in that example they said, okay, 10 to 15 minutes I can sit, and then we can start working on that. And then the cool thing is I can give them an experience where they can change their pain. So either through breath or mindfulness or some novel some other novel input. And then it's like, isn't that cool? You're able to change the pain. So that I think is one of my biggest lessons in the last few years is, because I do have a tendency to like to, talk. And what I've learned in the last few years is experience. Give the person an experience, and then sprinkle in. And
And so I go by the theory that people only hear 20% is what the research says. I find my patients really hear about 10% of what I say.
Yeah, because the rest of it is freaking out.
So I have quit doing this overabundance of education and all this stuff. And it's, when they leave, it's like, if it's okay with you, I'm going to send you some resources. I want you to, if you have time, I want you to take a look at this. This is going to talk about this. Remember that little bit of stuff we were talking about with the pain stuff? Here's a great video. Also, but I'm going to send all this out to you. So because it's just, because I want to do the experiential part.
Yeah.
So if they tell me, 15 minutes and it's bothered me, I'll just say, how long have we been sitting here? And they'll go, oh, about such and such. It's like, what do you need to do? Do we need to move them? Oh no, I can do it. And I said, but the point is, let's change it. I know you can push through it. You're a warrior.
Yeah.
Look at what you've survived.
Yeah.
But let's change that now.
Body is resilient.
What can we do different? And then, like you say, maybe you bring in the breath. Or
it's
maybe they have to get up and lay down on the plinth for a while. And it's like, how are you doing now? How's your pain? Oh, it's back down again. Oh, that's really good. It really changed. And so, trying to, or even, it hurts every time I bend over. Let's find a different way to bend over.
Yeah.
Let's see if you can do it without hurting.
Sandy and Sarah talk about doing stuff upside down. And Sandy talks about violating expectations, which I love. So if you can't sit, well, can I get you to lie on the floor with your feet on a ball?
Yeah.
Can I get you to roll that ball around? Now can I get you to lie actually against a wall with the ball, so you're creating pressure on the perineum. Now can I get you to sit upside down? Hanging from the ceiling, because they have these things, and that's fab. I love those moments, because the bit I think that I like is with patients. I say the more that we're thinking about the pain, the more that your system is expecting more bears. So let's do an experiential. Let's change it up somehow. I've got a great series of films of one girl who had horrendous pelvic pain. She's quite young, quite fit, CrossFitter, who. She starts off, we have an Alter-G, we're very lucky, anti-gravity treadmill, so she wanted to be able to run, do stuff, can't do anything, it all hurts. So we stick her on the anti-gravity treadmill and she runs, but with no gravity, and it's really easy. And I go, how's it going to go? It's fine. Okay, then a couple of sessions later we've got her on the bike, and she can do maybe 10 seconds, and then she needs to get out of the saddle and then get back down. I'm like, great. And then by the end of it we've got her squat jumping. And she was always told, we're not allowed to do that because it'll tension your pelvic floor, and it's the tension of the pelvic floor that's causing
So she was afraid to do things.
Yeah, and actually just
so just going to exercise probably was some bears for her, because what if I do something wrong?
Yeah.
And it's really, there's really no right or wrong way. Let's just kind of use your experience to guide.
Let's try and move
what's going on.
And it's, I think, I say to a lot of people, you've got to have the vocabulary of movement. Which is why I love doing the animal stuff this morning. It did make me laugh and giggle a little bit.
And it can be appropriate for some people, right? Especially if you need to help kind of get them going, loosen up a little bit.
Absolutely. Putting on beast mode, or whatever it was called, being beast, and then being loaded beast. It was great fun. But having a vocabulary where you can go, right, if you can't sit, what else can I get you to do? And then, so a long time ago when I did Pilates training, they talk about scissors level 1, where you do your stepping, you see the rotation, whatever, it being equivalent to walking, and then getting them to walk lying down and stuff. And if you say to someone, if someone's having trouble with walking, with PGP, and you actually get them strengthened, get them sideways and doing that, and you're like, well, you're walking. And they go, oh, I can do this.
This is the same movement.
Yeah, this is the same movement, I'm just not as loaded. Okay, can we do it in a different way?
It's kind of confronting them with, with their
expectations.
Yeah, doing the confronting thing. I had a young dancer whose mother brought her to me because she had pain all the way down the left side of her back, all the way down the back of her leg, all the way down, to the outside of her knee, and the whole thing was, let's get you to move in a way that it doesn't hurt. Let's change it. Stay and dance. We're just going to change how you're doing things for the short term so that your system can settle down. Talk a little bit about desensitizing, just widespread types of things, and then 2 visits later, she's moving so much better and doing so many wonderful things that I can tell she's kind of worried. And I said, what's bothering you? And she goes, well, what am I going to do when this comes back? And I said, you've already had a flare.
Yeah.
And what did you do? She goes, well, I took the night off. And I said, and the outcome of that was I felt so much better the next day. And I said, you know this, you've got this, you know.
Yeah.
And so I said, what else do you do? Is it just dance in school? What else do you do? No, I'm in the band. You're in the band. What do you play? I mean, this little bitty.
Yeah.
I play the tuba.
Yeah.
It's like,
Oh, okay.
do you march with the sousaphone? She goes, oh, yes. And I said, you're going to sit here and tell me that you can march. Do you have any pain when you do it?
No.
She goes, no, I've never had pain doing that. I said, how is that different from this? And she kind of looked at that and she goes, that is, what? Well, why would I, well, I never even thought of that, you know, but it was just, she didn't expect that to be a problem. She expected dance to be a problem. And the reason it was a problem is because her older sister has the same kind of pain, and her mother has had hip pain for a long time. And, you know, so it wasn't really the activity, but it was the expectations around the activity. It's always going to hurt if you're a dancer. You're always going to have to pursue pain if you're a dancer. But she's, this thing that weighs about 90 pounds, dripping wet, is carrying a sousaphone and marching on concrete streets.
Yeah.
Because they're getting ready to go to Disney.
The brain is
no
an amazing
problem,
thing.
whatever. So it's just like, so that was it. She's so smart. She just like bought right into it, you know. But it was so interesting. It was interesting to me too, because it was like, well, there it is, another complete example of
expectation.
of what that is.
And within families, and you get so many people that say, "Oh, my dad's in a wheelchair, my mum's in a wheelchair."
Mhm.
But yeah, the expectation of patients is that's sometimes the challenging bit, especially when they've had lots of intervention, and then you might be the third or the fourth physio that sees them,
or the 8th or the 9th.
Yeah. And it's 7 or 8 years, and the way that you do things, I think we all approach things. We have very different practices, I'm sure, but we approach things in the same way. That start with a person and go outwards.
We have a common language. We have a common type of
way holistically that we talk to people.
Yeah, and it's interesting. The more experience that I'm getting, the more I'm learning, the more I'm teaching. In some ways, I'm finding it harder to answer some of the questions from the students because
they're looking for the one way.
They're looking for the one way, and it was like, well, 5 years ago even, but 10 years ago, like I feel like I had kind of answers for people, and the more that I'm learning and experiencing, my answer is like, well, it depends, and I best can answer it with an example. I'm always like, well, it depends on the person. Because I feed off that person, what they tell. Then it's a dance, and then whatever I'm going to say or do next, and then whatever
it's
they
driven
do,
by them.
it's
not
driven
by
by them. So for me to answer a question,
and that was the hardest
it's
thing for
really
me
hard
when
to
I
start
switched over
educating.
to all this was to take myself and my ego out of the control,
Yeah.
and to really allow this person in front of me to
they're the
really
driver.
and just go with it.
Yeah.
And really, and just get
comfortable
curious.
with
Like, my questions are now all driven out of curiosity instead of saying, do you do this or do you do that? It's like, what would happen if you did such and such? You know, so I can get them to continue to be the driver. And it was,
So when you're an educator, it's harder to answer questions because it's like, well, I need a person in front of me so I can tell you how I would answer that question.
I can best show you by doing it.
Because it's going to be different for
X, Y, Z.
everyone in front of me. It's going to be different, but there's commonalities, of course, and that's what you teach on, right? You teach on the concepts and models.
And that's what Jenny was saying about the evidence base, that she does in her group have a lot of go about seeing the human in front of you. And you've got to go with your gut a lot, and I get that. I'm massively evidence driven. I love doing research, being involved in research, but people read research and they read the abstracts and they go. So thing that off the top of my head I can quote lots of because I read a lot of it. So using the Theron, doing myofascial release for pelvic floor pain, I know that we should have more than a 45% to a 60% reduction in pain in 5 to 6 weeks is an average of 8 different of the main papers. But that was based on women in 2 studies that had this type of urological pelvic pain.
Right.
Some men, a couple of women in one of the studies they they had had it for 7 years. In another one, they had to have just had it between 6 months and 1 year.
Yeah.
So you've got all these different populations.
So in a meta-analysis, it's not going to wash out as anything. In fact, it's going to be on the wrong side of the systematic review line.
Yeah, and what actually all you can say is
they're not going to match up. The statistics will never match up.
No, because you need to do it 1,000 times. But you can only say, well, in lots of different populations, this kind of technique seems to be beneficial. And what lots of people are saying is that this is beneficial generally, and the way that they've done it, we know some things that we can state, so doing it gently sub-threat, as I call it, not doing really heavy pressures.
Right.
When you do heavy pressures, not tolerated to the patient. I use heavy pressure sometimes, but if it's tolerated to the patient, and if it's called for, and it doesn't need to be heavy very often, then you can, if you do heavy pressures, it makes it worse. If you do lighter pressures that are tolerated, it's just desensitization. That's all we're achieving. That works. So you've got to, so when people say like how many times do I need to do it, how much can I do it, it's not realistic in my NHS timescale. I'm like, it totally is, and it doesn't need to be you doing it.
Right. This is the one thing about using a modality like that is advocating for the patient to be able to understand how to care for themselves.
Yeah.
And so the time you spend is working with them, and you're asking the questions. I learned this from you and from Neil. In some of your stuff.
Yeah.
And it was like, go on the journey with them, and as they're doing it, ask the questions that get curious again. How's your pain right now?
Yeah.
Oh, it's really hurting.
Do you feel
wait, do you need to back off of pressing? Oh, because
That's
we just
okay.
talked about don't press till it hurts, or don't press till this or this, and then they go to do it, and they take themselves into that experience that's familiar to them because it's running around as their pattern. And being able to like work, to me, that's where you would work, is like, let's spend the time with it. It's like with you, what we're doing with movement, and okay, we understand, we're gonna do this, we're not gonna move into ways that are gonna really spike the stuff, we're gonna explore it and kind of do it, and then they start to move, and the next you look at them and you think, what's going on?
Yeah.
How are you feeling? Oh, this is killing me.
Stop.
Let's go over it. Here's
let's try and keep it sub-threat.
Right.
And
This is how easy this can creep back on you.
Yeah.
And you can talk about this oftentimes why we get into flares, because we just run over this sometimes instead of like taking that step back and going, okay, let's really put it into practice.
Progressively loading is something that we always do.
But that makes sense to us.
Yeah.
It doesn't make sense to them.
No.
Yeah.
It really doesn't. They don't get that concept right away. They do. They definitely will, but they really don't get it right away.
That's what I love about that's the pain care yoga guidelines, and so that of course Neil Pearson, he developed them, but it's asking the question. So if you're trying to recover movement in the face of pain, because you can't always avoid when it's persistent pain, you can't avoid it, of course, as we know, because you want to recover the movement, and then that threshold is just going to get lower and lower, and you can't push past it and ignore it, because then the whole system will get cranky if you ignore it and push past. So the going to the edge of the pain, or where you can still feel safe, and asking, like, do I feel safe? So like what you were saying, this is part of the guidelines, is the person is empowered, so they can go home and do their exercise or their walk or whatever.
Because
they have a little protocol. Do I feel safe
with that, or do I feel like this
is
is
scary? I'm gonna pay for it later, and then keep your breath calm as you can, which you practice in an isolated setting, but keep your breath calm, your body tension as low as you can, and monitor the pain. But it's just, those are kind of simple guidelines, but if you do practice them, and the keeping the breath calm and the body tension low, that's way easier said than done, but that's part of what we can do in our sessions together, right, is practice that in a position of safety and rest, so that you can get good at it when the challenge comes. So, do I feel safe? Do I feel like I'm going to pay for it later? Like, no, I feel safe, and I feel like I can do this even though it's hurting. Now keep your breath calm. Oh yeah, I was holding it. Do this. Okay, now keep your body tension low. Okay, I know how to do that because we've been practicing it for 2 months.
Yeah, let go.
So, okay, I know how to do that now, and monitor the pain. and you have full agency. I mean, you know, you can stop, you can modify, and I mean, there's no one recipe, but those guidelines, I haven't like that. They really are lovely
what it
for
intrinsically
people.
always comes back to in the literature and out in the kind of in the social literature as well as the evidence-based literature is self-efficacy. And the power is in if the patient has this self-efficacy that they can create their own change, or they know how they are moving forward, you get exponentially better improvement than being like, come here and I'm going to prod your pelvic floor and I'm going to bend you and I'm going to snap you. You know, it's
and you're going to do this at home.
and
they don't want to do it at home.
Outcomes aren't nearly as
And so the word compliance actually means subservient.
Yeah.
Right?
Yeah.
So we talk about our patients being compliant.
That is good. I think I used that term today. Or did I use it in this intro? I used it.
We're actually asking them to be subservient to us instead of
compliant.
Self-effective.
Well, I don't know.
I don't like that word, and I do remember that coming out of my mouth. And even when I said it,
well, it's such a language.
I remember even when I know. Well, I wrote it. I've written it in my notes
this week.
Times.
Yeah, same. I'm sure I've used it this week. I'm going to change it.
So.
But
what other language do we use?
Compliance. We use so much rubbish.
Well, no. In place of, if we're trying to discuss
how much they've managed
compliance, what's the other word?
Achieved. I don't know.
Is the person sustaining their
maintaining?
There you go. Just something simple.
But I think
how are they able to
another
maintain?
thing I think I possibly stole from Sandy was the patient is the expert in their own body.
Yeah.
And I say that to every single person. I say
their inner wisdom is so key.
Yeah, because
they've just forgotten how to tap into it.
Yeah.
They know it. It's there.
And they just need a bit of guidance.
And if you give them enough time, they will answer your questions.
Yeah.
You know, because I know people are afraid of silence, and you got to get comfortable with silence with your patients.
Wait for eight. I learned that from Maxi Misiek at the San Diego Pain Summit.
Wait for 8 seconds.
Wait for 8 seconds. That's a
pen
long
down.
time. But
pen down so that you're not double timing, so they see your attention.
Right. No, I just sit with them. And, you know, if you need to, you can create a sacred space and just think, okay, I'm going to ask them this question. I'm just going to space hold this for them.
Yeah.
So that you have something that feels better for you, perhaps a little bit, while you're paying attention to them. And they feel it when you do stuff like that.
Yeah.
And they, you know, no one's ever asked them, and it's just going to take them a while to articulate it.
Yeah.
You know, they have been silenced for so long, or have silenced themselves, or for whatever has happened. And their ability to begin to speak about it, you know, in those deeper ways is just so healing for them.
Even the patients, I think a lot of physios that aren't comfortable in that vulnerable space will also struggle with the patients who have been ignored, because they're the ones that come in and say, and then on the Friday I did this, and then on the Saturday it was hurting, and they have all of this because I need you to listen to me. And
I'm going to spit it out as fast as I can, because I know you're going to stop looking at me in about, 30 seconds or something. Like there's some article that was written about, like ridiculous 11. What time people started interrupting them.
I think it's 11.
And here's the funny thing too, there's evidence that shows that if you interrupt them, they're going to go all the way back to the beginning and start again. So for those that worry about time, it's like you're better off to really sit back and listen and ask curiosity questions.
Yeah.
Rather than trying to guide them down the road, because they're gonna keep circling back.
And they need to tell you. And actually, I don't know if it's a trick. I've learnt this from somebody that possibly Karen, my old mentor, who was incredibly wise. That she just said, remember the highlights, because if that patient comes back to you the next week and something comes up and you say, I remember because of their car accident. And in numerous tricky situations, and I spent 5-6 years working on and off in a rape and abuse clinic, and in numerous situations where you don't want to refer to it, but you want to remember and want to say, I remember you, I hear you. If you can remember and you say, oh, well, yeah, because you were on the passenger side, weren't you? Or just a little something that was important to them, then actually it means that they don't have to go back through the whole of their story again.
Right. Oh, that's right, the accident when you were on your way to your daughter's wedding.
Yeah.
I remember you telling me about that. That was...
And that works for everything.
Big thing. Yeah.
You know, remembering how was your holiday last week? I'm looking forward to you telling me about it. It will take you 10 seconds, they'll show you a couple of photos, or they'll tell you about it for half a minute, and you've got them for a session,
Mm-hmm.
and they feel comfortable and safe and loved. And we were talking a little bit, like I'm getting full on hippy dippy, but I do feel like you've got to give it a certain amount of love to every patient and show them that you care.
And what was that you were saying yesterday about the definitions of love?
We talked about this
Right.
yesterday. And I have this in my book chapter at the very end. I say I think that all of us therapists should develop loving relationships with the people we serve.
Yeah.
And by loving relationships, by love, it's the definition of love by Humberto Maturana. He's a Chilean biologist, and he defines love as the act of allowing another to be a legitimate other. And by that definition, I think we
And
should
that's
develop
what
loving relationships.
That story you were just telling does, is that gives legitimacy to who they are, and that their story matters. And I think that's so powerful.
Oh,
so
and
powerful.
Lorimer Mosley, we all know our beloved Lorimer Mosley, and we know Joletta Belton, person, a huge pain advocate right now. She's doing a lot of speaking and writing. I don't know if you know this story, but when she had the chance to meet Lorimer in person and thank him for everything he did for her and all his knowledge and everything she learned, she asked him, what is the most important thing that you would tell people in pain, or that you think people in pain should know? So this is Lorimer Mosley, the leading pain researcher, or one of the leading pain researchers, and he said, to love and be loved. That's what Lorimer said.
Lorimer.
This is a pain researcher, he's researching biology and
He absolutely gets it.
and David Butler recently reviewed our book, and he wrote a nice little endorsement, and I don't know if I'm going to remember exactly what he said, but he said something at the end that said, reading this book, or just realizing yoga and science and pain care, he says peace should be an outcome for people in pain.
Yeah.
Yeah, that's great.
Doesn't that give you
That's
goosebumps?
great.
These
Yeah, I
are
love
the
it.
two,
But
they're
that's
two
ultimately
kind
what,
of moguls of
my
pain.
hashtag that I write on social media
Love,
all the time is
peace,
peace be the
purpose.
journey.
Yeah.
Peace be the
Peace be the journey.
Peace be the journey.
And I picked it up off of there was a movie about the Jamaicans bobsled team.
Yeah.
Calgary, right?
What is that? Cool
When
Runnings.
Calgary, yeah,
Oh,
Cool
my
Runnings.
goodness.
That was one of their things was peace be the journey, and I love that saying. So I use that on my hashtags all the time, especially when people are struggling, because
Peace,
we're all going to struggle, but
We can give each other just a moment of it.
Yeah.
You may not achieve it with everyone, but you can try.
yeah.
But then,
And you may have days where you can't achieve it, but the next day you can.
Yeah.
You
Yes.
can get back to it.
Totally.
Yeah.
That's a good point.
And that's like
Yeah.
pain flares.
yeah.
When they can begin to see that they're going to have them. I remember Laura Moore talking about this too, and all my colleagues that I've talked about it a million times. Pain flares are inevitable. They're going to happen. It's like stress is inevitable. It's going to happen. What I want for you is to be able to move through to the other side again, and have the courage that you can do that.
Yeah.
And the knowledge that you can do it. And most of the time, they've already done it. They just haven't looked at it that way.
Yeah.
Just think, I just keep having these damn flares. It's like, yeah, but what happens in between?
Yeah.
If we could maximize what's happening in between, that would be good, right? Or maybe what's happening in between is driving these flares. I feel so good, so what do? I clean my house, I cook 12 meals, I run and do this, I buy all the shopping, and it's like, and how did that work out for you?
Yeah.
It's like, that was an awful lot to do in one day when you haven't done anything for 4, you know?
So
and
many
I felt
people
good that
struggle
day,
with
and it's like, yeah, it's good, but if you spread this out, perhaps, or my question is always, what would happen if you spread that out over the week instead of trying to do it all at once in one day with this outcome? Would that change your expectations about what might happen?
Or was it worth it?
Yeah.
And that could be another question: is
I-
was that worth it?
She
And
was
they may say, yeah, I can handle.
Bronnie
I can
Thompson
handle
is the
flare.
biggest one on that. She's like, how did that work out for you?
Yeah.
And she does it in such a great way that it's not snarky at all.
Yeah.
But it's like that
Yeah.
confrontation, like,
Yeah.
and did it work?
Yeah.
You know?
Yeah.
Instead of let's feel sorry about it, it's kind of, that sympathy versus empathy. The empathy is like, how did that work?
Yeah.
Gosh, that sounds tough,
Yeah. Did you need to do all of that? Yeah. No, one of the things that sticks in my brain is that, I'm trying to remember his second name, Mark. Oh, I always forget it. He'll kill me, but anyway, is the brain, given incomplete data, always defers to negative, because it's always trying to keep you alive. So they will always remember the flares.
But we have the negative bias, right?
Yeah, so they won't remember that actually in the meantime they did manage a couple of days and it was okay, and then they went mad. They'll just always remember, well, I've had 6 flares this year, or it happens every 2 weeks, and I've had a flare for the last 2 weeks. And so many
That's
patients that, one of my patients from a while ago who had really bad pain with sitting and lots of pelvic pain and couldn't sit down for more than 4 minutes, and I would get emails saying that would start with, I can't sit down, I can't do my job, I've started with 4 hours a day, and then she got really into sport, and then it would say, I can't do 40 miles on the bike, and I'd go, wow, that's amazing, you've done, you got beyond 4 minutes sitting on a bike, you've got to 40 miles, yeah, but it makes me really hurt. Okay, can you do 35?
What would happen if you did a little less? What would that look like? Yeah.
And like how to
You think you
the
could do
transition
that?
of getting all the way up to that, and she had made it. She'd made all this way, and it had taken 8-9 months. But people will go, well, but I can't do it. But you can do 20 miles, and 6 months ago you
What
couldn't
can you
sit.
do? Just keep bumping up what you can do.
What are we celebrating today?
Yeah.
I love that. What are we celebrating today?
So I think that's also interesting about the pain flares. They only remember the negative, or they revert to the negative. But it's interesting too. What do we learn the most from? Our successes or our failures?
Failures.
And I think that's where we need to guide them. That it's. I'm glad you're telling me about your flares, because what can we figure out around this? Right? Because when they're successful, they're hey, woo!
Yeah.
And that's just a great life lesson.
Yeah.
I mean, Jenny was even kind of talking about that
Yeah.
this morning in her keynote, all the struggles and that.
It's important not to forget those in your life.
Yeah.
And they're what mold you, but then what can you learn from them too? What can you learn from them?
Because there are times in your life,
Can be
even
gifts.
even people in pain, there's times in their life where they struggled with something. And how did you manage, what happened? How did you get, find the successes that they had with the struggle? And then is there any way that you can bring some of those ideas here? Because it's really not that different. It's just...
And two, focusing, I mean, we've sort of said this already, but just focusing on, like, what are you doing well? I guess it's the same as what your celebration is today, but just elaborating even a bit more on that, and just saying, like, look at how much pain you are in, and wow, like, you're here, like, you made it. That was said a couple times today too. Like, this is incredible. You are extremely resilient. So what are you doing to do so well?
Yeah.
Like, sort of reframing even that.
And when they all say, I have a really high pain tolerance, because they want you to know how bad it is.
Yeah.
And it's like, and that's
Well,
a great line to use there. Wow, how are you making it day to day? This is amazing.
Yeah.
Because you have been through a lot. You look at everything you've survived and you're dealing with.
Oh yeah,
I mean, some of the
good?
most.
I mean, if you think
doing
about
some good
it,
stuff to be here.
if you think about it, some of the most resilient people are people who are living with persistent pain.
Yeah.
I mean, think about it. So let's learn from what are you doing?
Right.
That's
How do you
amazing.
survive day to day?
Yeah.
A lot of them aren't very functional with it, but some of them are.
Yeah, I mean.
But they can learn to be more
And
functional
you
with
can
it.
learn,
if
and
it's
tell
important
us-
to them,
Yeah, and
Tell
if
us
it's
what
not,
you
if
are
the function
doing.
is meaningful to them.
yeah. And there are plenty of people that actually are surviving very well in that pain state with that pain. I can think of 3 or 4 patients that I've been trying to wean off for a while from any interaction, just because they're not making progress, but they're also, their life is going quite well.
Yeah, and even when you said, some people aren't functioning well, and it's a continuum, and it's I mean, obviously it's not for us to judge who's doing well or not, it's however that person feels. But what I would say to that is, even just, if we're seeing someone, they were able, and this is what I'm saying, the victories, they were able to get out of bed and wash and brush their teeth and dress, and they were able to hold that appointment and come to that appointment. That's huge.
Yeah.
Mm-hmm.
It's a big
So
win.
like, you know, it's
Yeah.
just, and I'm sure they have a lot of those little wins. I mean, it's similar to what you were saying.
Right.
What are the small victories? But I just wanted to emphasize that, like
Mhm.
the
I think it's
They
important
made
to
how much,
emphasize it.
how resilient and how resilient and strong, really.
And
you
that
are.
translates to all of pelvic health, I think, generally, and it's not just about pain patients, because some women it isn't such a thing, but for quite a lot of people coming to talk about your nether regions and your, you know, having the embarrassment of factor of a prolapse or continuing treatment with gynecologists and urologists and then coming to see the physio, actually them showing up and being brave enough to do it. I know a lot of people won't do that.
Right.
You know, we know there's a huge proportion of the population that are incontinent that do nothing about it because it's just too shameful to kind of to present. So,
Or they just don't believe that we're going to solve their problem.
yeah,
They think it's normal because
it's what happens
They
when you
just
have a
want to
baby.
do let's put my head in the sand and hope it goes away.
Yeah, get a pad.
Right, yeah. I'll just get a pad and soldier on because I have so much to do for everybody else and I
Yeah.
don't have time to deal with this. I'll deal with this later. You know, and it's like radical self-care.
Radical self-care. That
We're
was
in the-
one of the Katie Kettner and I talked about that at the beginning of the year. That that's what we need to have, and certainly as the world
When the
develops.
chips are down,
chronic-
you really need it because everybody does when this crisis is over, I'll do this. And it's like, no, when the crisis is upon you, radical self-care. That was a hard lesson for me to learn.
ask for help. You
Absolutely,
said that
that's-
today.
yeah.
I loved when you said that today in your presentation.
Yeah.
And you said it, the way you said it too was, you know, you said, how did you say, you said, and you said from a
Ask for your
friend.
friends,
You
yeah.
said, ask your friend for help. And you said it,
Don't ask the friend that's, you know,
It's busy.
ask the appropriate friend for help.
yeah,
So-
but you said something else. Or was it?
People always do it. at
Oh
the
no,
wrong
when you
times.
need it,
When you need it most. we
and
don't
when
do
you
it.
need it the most is when you don't usually
Right.
ask.
That's exactly right.
Yeah, you said that, and I just thought that was brilliant. I mean, it's like another simple sort of
Right,
concept,
but we're kind of programmed to like do it all yourself.
Yeah.
and when
You know,
It
when
takes
things,
vulnerability to say, I'm
Yeah.
not coping with this particular thing. What did you say? Like, you need to make me some food.
So it is also important to ask the right people for help.
yeah,
Yeah.
good
So
point.
one of your friends may be the most awesome organized person that can like pick up the kids and
Yeah.
do this and do that and those types of things. And the other one, like I think I said today, who's your super healthy friend, the one that's always cooking.
Yeah.
See if call them, see if they can help you and make some extra stuff for you so that you can get through this hard time.
Yeah.
You know, so you don't have to stop and chop vegetables. You know, that you can just have them already ready to go, pull them out of the freezer, put them into the
And they're done.
oven. You know, and you're getting your nutritious food because somebody's helping you prepare it.
Mhm.
So one of the other things that I've learned through all of my coaching stuff and myself and working with all of these types of women especially, but it applies to men too, is I'll just when I get resistance when I ask them about their web of support. You know, what does your web of support look like? Who is on it? You know, have you really thought about who can be of help to you? I don't want to bother anybody with
Yeah,
this.
no one wants to bother
And so
anyone.
here's what I love to do is like, I want you to just sit for a second and think about the last time somebody really important in your life asked you for some support or some help. And I just leave them with it for a little bit. And I'll just say, how did that feel? And most of the time they tear up, but they have this very visceral feeling like it felt really good to help them. And I'll say, why are you denying the closest people in your life to feel this good?
Suzanne, you make me cry.
I know, right? Because
And
not
you came-
myself.
And you came up with that on your own?
I
Is
didn't.
that your
I don't know
own
if I
little-
came. That story I
That's
did.
beautiful what you did
But I'm
there.
sure it
Yes.
came from many people convincing me that I needed to not shoulder their
Right,
general
but I mean that-
responsibility on my own.
That
but
what
yeah.
you did there though, like with, or what you do with people when they say that, your
Yeah.
ability to come up with, you know, turning it around and asking them that, like that's brilliant.
It's beautiful coaching language, and yeah.
But it just helps them identify with that feeling, like, oh, if that person,
It's brilliant.
because they think it's negative.
It's brilliant, yeah. But when you
know,
flip it,
like,
you
I'm
realize.
like, yeah, it's like, no, it
that's
isn't negative.
brilliant.
It's really,
That's
really,
brilliant. Yeah, and
really
that gives them.
positive.
That's similar to what we're saying. Like
So
that's
they
giving
got
the
that
person the
experience to go home
It's
and
giving
think
them-
about,
Yeah.
right? Instead of just like, I know I should.
Yeah.
Yeah.
I know I should.
Yeah, because you can talk.
I'll have to ask for
Right?
help when we call my mom
But you
or
know,
somebody. Yeah, it's like,
People
oh,
come from that point of view where if they're
It's just
stressed and
brilliant.
tired and whatever they're going through to be with physio, that they then think everyone else will feel the same.
right.
And so many people will say, oh, I don't want to bother them, they're really busy with their kids, with their parents, with their whatever. And you
Mhm.
go, well, no. They, you know,
Mhm.
if something happened, if you put yourself in their shoes, if this was happening to them, would you want to be there for them?
Mm-hmm.
Yes.
Exactly. And they're already doing it. They're just not thinking about it because,
Yeah.
I mean, moms already have carpools. You know, they all work and they're all busy and, you know, I hear it all the time. Well, so and so's picking up the kids and I'm going to go do this and blah 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 blah. You know, and so it's like, well, what about for this stuff?
Yeah.
You know, and they just think, oh no, I could. You know, it's like, well, what if somebody asked you?
I need a notepad because there's a couple things that I've been wanting. No, really, and then I've been trying to remember, but at the same time stay present and.
You can watch it back.
And I'm like, oh, that's right.
We're
Good
videoing
point.
this. It's not like last night's conversation. We actually videoed this one.
Good point. I can
Yeah.
write it down. Thank you.
You're welcome. I just so happen to have paper right there.
We provided. Yeah, so many knowledge bombs. Is there, I don't know, in the last week of working, not of teaching and the rest of it, with patients, tell me about a really big success that you've both had that's just made, it could be tiny, but something that's made you think that worked really well, so that we can all learn small pearls of wisdom.
Well, I've already told one.
Okay.
Because it was the young dancer with the widespread pain that
Just carrying the tuba.
is wearing a sousaphone around her body and doesn't hurt when she marches. She's doing really well, but returning her self-efficacy to her and
Changing her mindset.
create
and
well and
expectations.
when she had her flare, she was very upset about it, and she told me all the things that she did, and it was all the opposite things that she used to do. Because she would say when she first hurt, she would I would go home and I'd roll out and I'd stretch and I'd do all this stuff, and it was worse. So this time she actually just went home and did nothing. Like she just allowed herself to just I need to do nothing. And the next day she felt 10 times better. And all I did was tell her, you absolutely did the right thing. You know, you knew what to do, you followed through on it, you did it.
Validating her experience as her body's best expert.
She figured it out, you know, it had nothing to do with me. She figured it all out, she did it all, she made a difference, she was upset about the flare,
Yeah.
and so all I did was point out the success,
Yeah.
you know, and show her what she did and how it was right. And the next week, because I treat her mom too, the next week her mom came in and she said, I should have emailed you. She goes, whatever you said to her, and she goes, I've never seen her so happy and so empowered. So it was like all I did was just say, right on, sister,
Yeah.
march on. So that would be probably the biggest
Amazing.
one that I had, yeah.
Empowering people.
I think I was just thinking of last 2 weeks ago, and it was just a nice session. But a gentleman that has persistent back pain, pretty much 20 years, 5 surgeries. I've been seeing him for a while, and when I say a while, like off and on for about 4 years,
Mm-hmm.
and then he'll get to a certain level, and then it's good, and then he'll sort of have a come back because now he wants to play 18 holes of golf, and so
I love golf
so he
so
wants
much.
to keep basically activities that he never thought he would ever return to.
Which is beautiful.
He
he's doing
I
it.
think so. Then he'll come back to see me to
Yeah.
kind of get prepared for this next
That's
activity.
awesome.
And
That's
so
really
that's
good.
sort of been the 4
That's
years.
awesome.
Yeah, it's really cool.
It's like
Proactive
Yeah,
self-care.
he's
He's kind of like,
super.
okay, if I could do this, maybe I can do
Yeah,
that.
and
Like, so
kind
he's confronting his own fears.
he is,
And his own avoidance, you know?
and taking steps to
To address
move past
it.
it.
Yeah, so he came back a couple weeks ago. I hadn't seen him in a while. And this time, his reason for a little check-in was he wants to get, I don't want to, tell too much of the story just for confidentiality in that, but basically he's at a point now where, and I think I might tear up, he wants to now get off, he wants to try to wean off his opioid medication.
Wow.
That's fantastic.
Yeah.
What a journey for him.
That's a huge
Now he needs to like start writing.
Yeah.
What a great journey to be able to share with others or record him or something.
Yeah,
wow.
film him.
Yeah, so, but the session that we had was, he wasn't ready yet, but it was just, this was what he wanted to, and as a check-in, and so I was like, well, how can I serve you today? Like, what do you need today? Like, so this is that whole,
Right.
I'm just dancing, and where are you at? What do you need? So that was one goal. Okay, this is what you're here for. But that day, what he wanted was, like, he really likes guided meditations. He meditates on his own now, but he said he's sort of been negating that, and he's busy with some stuff, and he said, I just feel like I want a really nice guided, meditation and some like mindful, like movement, like a movement practice, but he didn't want anything, he didn't say this in so many words, but he wanted to, it sounded like he just wanted to center and calm his nervous system, and sometimes we don't always do that, like sometimes it's more challenging, and so I said, okay, let's go. So we had, this 45-minute session, and so I'll just tell you, he had stiffened up, just because just with all the stuff and everything. His pain was, he says he calls it the it factor. This it, like it's like, and he hasn't had that in years. But he says, oh no, that it's not that. It's just I'm stiff and there's pain, And
He's learned the difference.
Oh yeah,
now,
yeah.
which is
No,
so
he's
awesome.
good. Yeah, it's beautiful.
It's like, and I've been busy.
Yeah, it's beautiful. Yeah, so he knows. But here, this gets better. He knew that he needed this, like the stillness, the breath stuff. He does this 4-part breath and the guided meditation, and then this little movement sequence that he does. He knew that, and so he comes. Oh, so he was very, and you could tell how he kind of goes down to put his keys down, and he just that whole protection, and he knows, and he's trying to be loose, and he knows how to do it, but he's like, I know I'll be fine. Like after this session, I just need to. Okay, so we have this session. It's a guided it's like and he can go long. I never go this long with usually people, but he's been doing it for so long. So 20 minutes. He can lay there, full body scan, guided meditation, 4-part breath. Some, then we get into the movement, gentle, mindful movement, some mantras, just a beautiful session. And this is all, by the way, this is all lying down and, rolling back. And it's all that he had time for. Oh, actually, no, we did some 4-point stuff and we were moving around. And I could have stayed longer, but time was up and he had to go. And so I'm like, okay, well, let's, see how you feel. And so his transfers, so to and from the floor. So when he went down, I wish I had a video camera, what that looked like. He got up. It was like fairy dust, like that. And then he was moving, and I showed him this kind of like hip kind of dancey thing. And so he was kind of moving his pelvis, and he's like, and then he practiced, or he tried like bending forward and actually flexing his spine, because he was always, because he was told to protect it.
Right, keep your back still.
So he knew.
Don't bend your back.
Yeah. So then he did this. He totally, and then he went all the way down, and then he rolled up, and his color was different. His face, his jaw, he just was. I mean,
did a reset.
It was kind of.
Made him feel safe.
Well, and
he came in and did a reset.
Yeah, but what I want people to understand too is I have been working with him for 4 years.
Right.
And
This is a journey.
this is, and we've had educational. I have sat down with him and gone through pain biology. He's watched lots of videos, read lots of resources. We've had the experience. He's had lots of little failures or flare-ups but then he learned from them, which is where he's at now. I wish he was here right now so he could explain. Yeah, we've talked about it.
Really beautiful.
So that just happened.
That's really
a couple weeks ago.
It's just like, it's a journey.
Yeah, and he did it.
Yeah,
Like,
it was his journey. He
I
came
just
to you and
guide.
said, "This
I
is what
just
I would like
guide.
to have from you today."
I just guided.
Uh-huh.
And another one thing that, and I'm on a roll now, but another thing is, I sensed he was in a place where, like, yes, he wanted to like just move, but it kind of reminded me as if I was back in the physiotherapy clinic, like the outpatient orthopedic clinic, and doing like manual, and there's nothing wrong with the hands-on, it has its purpose. But it kind of reminded me, if I was back in there and had like the 20-minute session or whatever, I feel like maybe, I might be wrong, but I feel like he would have came in and he's like, I just need, like some manual, which would be fine. But I'm saying, look at, now I could offer him that, but I had the hands on. He did it all by himself.
Right. He came and told you what he needed.
Yeah, but he can do that at home though, and he knows how to do that at home.
Sometimes people
so he can get that calming and that, like what people do, like of the passive treatment. He can give that to himself.
Right.
And I can. I'm sure you can, like with certain restorative, practices or breathing. Like that's really cool when you can give yourself that restoration.
Yeah.
Those are the relationships that I most enjoy in physio, and they're certainly since I left the NHS, and the NHS were not allowed to email patients, and so I'd give out the department phone number, and wherever I rotated to, they would say it was the Ginny hotline because patients would ring. But I'd maybe get 2 phone calls a day, and it was I'm a patient. If I need to talk to someone, I need to be able to get hold of them. And just having that, lots of patients, most people don't use it, but they try to. So now I use...
Every once in a while they'll do that same thing with me, and that's fine. I'm glad they do.
Yeah, and it means, you get a few messages, but actually what you're able to do is exactly that, is provide safety again from a distance. So I have an email address which is like notes. I keep it completely professional for patients only, and it's put into their notes. And patients reach out, and it's lovely. Those are the relationships I like, when you've built a relationship with someone, and I don't go out there to try and get them, but when you've helped someone on a journey and then they fly free and it's wonderful, and then you don't see them for a while, and then they come back in 6 months later and they email you and say, I want to come and talk to you about this, and then you sit and they go, okay, and it's like catching up with a friend but not, and I go, okay, so where are we, what great, oh wow, that's amazing, you're doing this now, fantastic. So I had a patient come in that's had quite a tricky postnatal situation. She's written me some blogs actually and some other bits and bobs, who is ready to take her health journey to the next level, and she wants to start running. She's had a urethra seal and some other issues, and they were a big issue for a while, and it's almost like she's expunged it from her system, and she's like, yeah, it's there sometimes and it's not sometimes else, and I know when it's going to be there, and I know what I needed to do, and then I'm not worried about it. And I went, that's amazing.
Yeah.
And then them knowing, but what you need to do for me today is I just want you to check everything like you used to. I want you to check my tummy, I want you to check my pelvic floor, because I need to know that I'm okay to now start progressing into running. And I did a pelvic floor screen, and she's got more than a reasonable pelvic floor, and I was like, yeah, there should be nothing that stops you from any movement now. Go and move, go and do stuff. Running is not going to stop you. Go for it.
I was going to read you this from somebody. See if I can find it.
We should do this more often. We should share our successes, because in physio so often we learn from failures, but we also need to learn from successes.
I agree.
And within, I'm all about empowering the next generation, learning from the amazingness of the generation before me, but empowering the generation below us to come up. And that's one of the girls I met today who's local to me. And giving them success and sharing successes is so empowering, because we don't get it right all the time, but when we do, it's life-changing.
Yeah, like it's you learn
so
from
this lovely person I've known for many years forwarded me a photo of my x-ray from her doc, and I'd like for you to review it, and I'm going to come in. And then she decided that so we did some things, and I got her moving in some different ways, pretty severe back SI pain deep into her pelvis, mostly was sitting, less was standing, movement was, sometimes was okay or bad, but it's been, kind of off and on, and she was really looking for answers. So we had her moving a little bit better. I gave her some stuff to read, and then she was doing well. Then she wrote back, feeling poorly, no radiology report, but we'll get you one for the MRI. suspected diagnosis intervertebral disc disorder with radiculopathy C later in January. This was back in January. And then I have the MRI results and 5 herniated discs, large, you know the story, all the things that went in there. So I want to talk about core issues, versus surgery. So I've set an appointment with you. It's okay. So we go through and I see her, and I just kind of ask her a number of things about what can you do, what do you want to do, what feels better to you. I feel better when I stand. I feel better when I stand this way and not this way. I feel better with this and this. And I said, can we capitalize on that? And she said, so you're saying I should get a standing desk? And I said, I'm not saying anything. I'm asking, would it be feasible for you to be on your feet a little bit more during the day and less sitting? And she goes, well, if I did get a standing desk, what kind should I get? And I said, one that stands up and sits down so that you're not locked in a position, so that you have movement. But, she goes, well, they'll get me one. And I said, okay, we'll go with that. And so in the meantime, we worked on just a couple of movement patterns to make her feel better moving in and out of bed, in and out of the car, in and out of the chair again. And then I get this note back, which was just last week. Just a quick note to let you know that I'm doing really well. Stand-up desk seems to be the key. Went to DC and walked 10 to 12 miles.
Wow.
Sitting for long periods is still bothersome. We'll schedule an appointment for next week, the next few months to work on flexibility. Have a nice Easter. So, but I love that sitting for long periods is still bothersome. Before it was like sitting for a short period of time was killing her, and she was just going to push through. She was going to push through.
I have to sit. I've got.
I have to have surgery. And the only way I'm going to do it is to have surgery. And I mean, I literally saw this person 4 times.
She
with all
solved her
this
own
time in
problem.
between. So she would take everything and go work on it.
Yeah.
And then when she would have some failures, she would call me back, and then the hopelessness and stuff. But but I've had a long relationship with her. But for her to write me into, it's like your patient who could ride 20 miles.
Yeah.
So my question to her is like, how long can you sit before it starts bothering you?
Yeah.
So that you can gauge that just a little bit better.
Yeah.
And she probably already knows the answer. So, which is good.
But that's awesome. She's, you've facilitated her own ability to solve her own problems and given her the.
Yep, she's
the
solving her own
self-efficacy
problems.
to do that.
And she didn't have a flare up after she walked 10 to 12 miles. I
Yeah,
mean,
that's
it's like,
a
that's a long walk. That's, I'm sure it was over, over 3 or 4 days, but still, that's a lot. So, and with an MRI like that, there's, it's not just because you have an MRI that shows one thing doesn't mean that you don't have a strong, resilient back.
Yeah.
But that was some of the information I gave her. And I actually sent her the research report, kind of a synopsis of it.
Yeah.
That I got from Corey Blinkenstaff's class, because he has a couple of those like patient handouts, and I had those on hand, and I said, I'm going to send you a couple of things.
Yeah.
And she was kind of amazed. She goes, oh, please do send this to me. And I said, sometimes it doesn't have to mean that there's something that has to be surgically removed.
Yeah. A lot of the time it's an incidental finding. 50% of people over the age of 50 have disc
Oh yeah,
paralysis.
that's what I told her. I said, look, if they put me next to you,
Yeah.
I'm sure my back would probably look like yours.
Yeah.
And it's okay.
Yeah. It's what happens.
Yeah.
I like I can't remember where I got the old
It's
shoe.
normal aging.
The old shoe rest thing from, but it was someone that's taught me at one point. I feel like I should be referencing them because they're on video. I can't remember who it was that said, well, you look at an old if you put an old shoe on, it's going to maybe have a couple of scuffs on it, and it might have a bit of area that's frayed and whatever, but it's really comfy, isn't it? It doesn't rub, and that's the point, that you've used your body. It's got some scuffs, it's got some areas that are a bit frayed,
But it's pretty comfy.
yeah,
it
it's
can do
comfy
it.
and it's resilient.
So just because it's there doesn't mean it's the reason,
Yeah.
so.
What has sensitized your system? Yes,
Yeah.
is it a structural thing that actually only surgery can deal with? Well, rarely. Most of the time we can calm
And
down.
she was one that was not going to buy into the pain biology. She just
Yeah.
wasn't, she goes, I'll go so far with you, but this whole thing about it being an expression from my brain, I'm not sure. And I said, you don't have to,
No.
but I said, I said, can you wrap your head around that the nerves are sensitive?
Yeah.
And that area has gotten a little bit sensitive?
Yeah.
And she goes, well, it's more than just a little sensitive. And it was like, well, okay, but can you go with me on that one? And she said, yeah, I can do that. It was like, okay, because she just couldn't get past the idea that it was coming from her brain, because some people just can't understand the old brain expression versus their cognitive brain, you know, so. But she was a smart person, and I said to her, "You're smart. You can figure this out. You can figure out what you can and can't do."
Yeah, you've done
And she
everything
goes,
else
"Just
now.
trust your inner wisdom. If you feel like sitting is not working for you, then find a way to stand some at work. You're just gonna have to, you know, if you want to stay in this job and do this work, the only thing that can change is your ability to make modifications within the thing in ways that feel comfortable and positive to you." So she figured it out. She thought up the standing desk all on her own, and
Patients, there's the wisdom within them. They have, if you give them the opportunity, and if we kind of take off some of our, like you were saying, take off your ego and go, I am sitting in front of a person that is as worthy as me. I have a certain amount of knowledge. They have a different type of knowledge. They have, you know, knowledge within their body. You know, the amount of times that we've all been patronised by medics. I have spent a lot of time in the health service being patronised by medics, saying, "Oh, we'll bring your INR down to this," and I'll go, "No, you won't. But I'll send my mum home to cook a kilogram of broccoli, and that will bring my INR down by tomorrow." And then they'll come back in and be like, "See?"
What's that meme that they have on social media? Don't confuse your 6 years of medical training with my 25 years of living. No, don't confuse your 6 years of, or I'm getting tired. There's some, it's something like that.
right.
Or don't confuse your 1 month of learning about my disease and medical training with my 25 years of living with
In
it,
this
or
body,
something like that.
Exactly. Like we, you know,
But
we
there's a flip side to that though too.
We do need medical knowledge to, you know, if our kidneys
Yeah,
are failing,
sure.
we need drugs.
Yeah.
If we, we need huge amounts of medical knowledge. But it just sometimes, from a physio perspective, we don't need to over medicalise.
But they should still, even the medical people should still,
Biopsychosocial.
well, yes, they should still work with the person.
Yeah.
Instead of, here you have to do this, and you know darn well through what you've been through that may not work for you, and you're not gonna do it.
Yeah.
They should be sitting there saying, "Okay, tell me your experience.
Well, and listening.
What worked and
Yeah.
what didn't, and where are you in trouble now? Or you just what are we doing here?
Yeah. What do
Right?
we
Are we
do?
looking just to see status quo? What are we doing? You know, that kind of thing.
Yeah.
And then it's like, you know,
And
Taking
just and saying things like, "Tell me more about that."
mm-hmm.
Like, even if someone does, you know, say something that, like, you think, well, I have a different perspective. So as a healthcare practitioner, let's say you think, well, if they would maybe try this certain thing, I think it would work. But even just listening, it's just going back to listening. And if that person is so adamant about what they're saying, "No, look, you know, it's tell me more about it." Like you said, it's listening to understand and not to fix.
Right.
It's listening to be curious, to learn. Tell me more about that. And so we're not, you know, trying to problem solve. And to say, well, I know this, and
What box do I know
first
about the
we're-
rotator cuff? What do I know about that?
and we can do that, but first it's gathering that information.
Who is this person? What do
and
they about?
Tell me
What's
more
the
about
problem
that.
there?
And oh no, I will never do that. Or oh no, that. Okay, tell me more about that.
They are not a shoulder, they're not a hip, they're not a back, they're not a
Yeah.
vagina or a penis. They are, you know, Mary or whatever.
Yeah.
And
they're smart, and people are smart. That's the
Mhm.
other thing too, right? Like, people
Mhm.
know.
But anyway, at that moment, I might say thank you very much to both of you, because I know that you're both getting tired and we're on different time zones still, maybe. I can't thank you enough for sharing your time and your brains and your knowledge and this amazing experience that you have from clinically and otherwise. It's so valuable, and I'm always just so incredibly grateful to mentors that give of their time and their experience, because it's how we all get better and how we all improve. And we learn from each other, so thank you so much.
Oh, thank you. Thanks for all your
welcome.
energy.
Thank you for your
You're
energy.
just amazing.
Is it
and
really
working
7 o'clock?
today.
Yep, that was 7 o'clock or just after, and I think we sat down sometime around about 5:15. So I had to cut it short then before we yelped, and I may have used a small expletive because we were meant to be at the conference dinner and we had to run away and get changed. Obviously I'd missed the red and black memo, but I'm kind of making up for it today. So that was wonderful, wasn't it? How great was that to hear all those pearls of wisdom? So don't forget, if you want more of this kind of content, if you want to hear more lectures or talks that I do with researchers. If you're interested in pelvic pain, then sign up to the subscription newsletter down below, and you can hear about my upcoming courses where I am all over the UK. You can get in touch with me via the website as well, or on Twitter, or on Facebook, or Instagram. And I'll let you know what's happening in the world of pelvic pain. And if you happen to be at World Congress in London the week after next, I hope to see you there. But until then, I hope you've enjoyed that, and I will speak to you soon.